Hi, I'm Ronnie Taylor. I am a MSW student attending Fresno State, and I am currently completing my internship placement at Fresno County Department of Behavioral Health. I think it's first really important for people to understand that the idea of mental health can be a very stigmatized concept. Oftentimes, you might hear people say that mental health services are for crazy people, for people who can't control their mind, for people who are weak or people who are getting to rock bottom. But not just that. Sometimes services themselves can be financially inaccessible or hard to get to depending on where you live. And as many of us know, historically, Black populations involved in mental health systems can leave feeling victimized or disrespected and misunderstood. We know that systemically, institutions and systems can a lot of the time perpetuate or contribute to harm and trauma within Black communities. So a lot of people, if they've had certain experiences with mental health systems, they don't want to get help from those systems specifically. So with that said, therapy ain't always it, but the good thing is wellness can be pursued in other areas, like engaging in your community. That can be, family, friends, neighborhood groups, interacting with people based on what you're interested in, what you like doing. You can pursue wellness through creative areas like art, music, dance. You could pursue wellness through connecting with your body. So anything that helps you move your body or increase your awareness of what's going on in your body, what you're feeling in your body, making sure you're nourishing your body. And I think a big source of wellness, especially in the Black community, is spirituality, which could, it could be your religious faith, religious practices, but it doesn't always have to be religious. It can also mean, practicing mindfulness or really engaging in anything that helps you feel like you have a place or a purpose in this existence. So I think it's important to normalize and encourage the use of these other approaches to mental health and wellness. But it's also important to view wellness as something we can do every day, something that we can kind of shape and tailor to our unique interests and our passions, not just something we do when, we're approaching a crisis, but something we can do as a preventative activity, something that can kind of add to our sense of connection or purpose, something to add to those areas where we do find joy or areas where we do find peace. I don't consider myself to be an expert necessarily. I think when it comes to the field of mental health or social sciences in general, there's always going to be more to learn just because society's changing, people are changing, everything's changing, and we need to adjust our learning based on those things. So I'd say I'm a lifelong learner. Just wanted to put out that disclaimer, but I am going to be graduating in May with my master's in social work. So over the past 2 years, I've completed my internship at several behavioral health agencies. And before starting my master's program, I worked in applied behavioral analysis for 4 years. So, in clinical settings, I'd say that I promote mental health and wellness first and foremost by, providing and holding a space for people to feel heard and to feel validated, whatever it is they're going through, and letting people know that their emotional experiences, their psychological experiences are natural responses to whatever circumstances are going on in their life. And from there I try to help people explore what sort of strengths or supports already exist in their life. So what things can they feel proud of, what are their current sources of hope or purpose, what are they doing right now that has been helpful in them coping, What are their sources of comfort, of joy? How are they problem solving? And then two, helping them identify the supportive people that they do have in their life. So where are their sources of connection, their sources of belonging, or the big ones, where are they getting love and acceptance from? So all of these areas, I'm kind of working with people to explore, with the hope of empowering them to include more of those things in their daily life. And of course, it's not a solution to the bigger systemic causes of the circumstances. Those are still there. We exist in a broader system, but these areas of wellness serve as a foundation to help people cope with their circumstances. It helps them to become more aware of what is in their control and what isn't in their control. It helps people to kind of savor areas that they do find joy and connection, and ultimately helps them to develop resilience even in the face of this greater hardship. But I also wanted to note, before doing my MSW program, I volunteered and worked with local nonprofits where I organized and facilitated different cultural art events. And I would like to return to that community practice because I was able to help people build a sense of belonging and connection, and help provide a space for people to express themselves creatively. And I believe that that ability to connect through expression is really essential to wellness. And it was one of the most fulfilling roles that I've ever played. So I hope to get back to that role as well. So I think I've always been drawn to mental health. Um, I'm willing to admit I've had my share of life challenges and mental health challenges going back to when I was a very young child. And those experiences led me to question, like, especially like in adolescence, I was asking myself things like, why am I the way I am? How can I help myself? How can I help others who are like me? And then, how can I advocate for myself and others? And how can I educate myself and others? So, that interest was always there. After high school, I earned my bachelor's degree in psychology from Fresno State. And after I graduated, me being, the multidimensional person I am, I didn't necessarily go directly into the field because I really wanted to invest in my passion for creative expression and music performance. Because, as I mentioned before, it's a really important part of my life, and it's kind of saved me and sustained me through certain periods of my life. It's connected me with some of my best friends, my best mentors. It's helped me to share parts of myself and my experiences with others, and all of that kind of helped me to gain confidence in myself. And over time, I, notice that I'm learning a lot from my community and learning a lot about my community through these activities and this work. And ultimately, I hope to bring, that mental health piece and that cultural art piece together at the community level, because I think they very often go hand in hand. And I believe it's where I'm meant to be. So, long story short, I was encouraged to pursue social work because there's room for that. Social work is a really broad and diverse field. So through community social work practice, I can definitely see myself doing good, fulfilling work within my community. I would say some of my favorite sources of wellness would be creative expression and community engagement. I know I keep going back to that, but it's really important to me, because I enjoy coming together and holding space with others around me. I like connecting through art, um, dance, food. I like connecting with others through joy, but I also like connecting through shared challenges I may have with others around me. Being able to kind of voice what it feels like to go through those challenges and vent and get it out. But even more, uh, be moved to do more, like engage in some activism or advocacy surrounding those things. But more specifically, I also enjoy DJing. I enjoy producing. I'm a percussionist, so I enjoy drumming. I like emceeing, writing, getting outside every once in a while and moving my body. And I like to love on my people, spend time with them, and spend time with my pets. Um, but yeah, ultimately, art and just being in my community has really been helpful in me finding those things that I need, like hope or belonging and empowerment, especially during the most challenging periods that I've had throughout my life.